The sickle cell disease is it's a very important health public problem, I would say, in Brazil and in Latin America, and mainly in Brazil because we have a lot of African descendants, and the sickle cell disease, it's need to be take care very serious. And American Society of Hematology and the Brazilian Society of Hematology, Chemotherapy and Cell Therapy, the BHH, have been working a lot to improve treatment, to improve protocols, and to improve the assistance and management for these patients. Recently, you had many data related to gene therapy to cure through the gene therapy the sickle cell disease, but we still need to develop this kind of treatment. Some results are very encouraging, but you had some issues in terms of malignant consequence and leukemia for this patient. But on the other hand, the bone marrow transplantation has been done for a long time with a very nice results. In the United States, they have very interesting protocols, and in the same way in the Europe, using some kind of mieloablative and non-mieloablative treatment using Alemtuzumab based conditioning with a Tiotepa. So these very nice protocols. In Brazil, we had developed Belinda Simões started this study 10 years ago because you don't have for everyone Tiotepa and Alemtuzumab. So we had to change the protocol, and you develop a protocol with Busulfano and Fludarabina and ATG. More than 50 patients were treated, and the results is very, very interesting. We had only one patient that died during the transplantation procedure, and the results, it's fantastic, and soon will be published to the whole scientific community. And the same way, these patients had also some of these patients lost the engraftment, but not as a near or early event, but it's a late event, so late graft loss happened, and we are still discussing why that happened with this patient and try to see the variables that could be implicated with. At the same way, you had also some preliminary data showing the impact of bone marrow transplantations in patients with a cerebral and vascular commitments. So this is a very interesting data because potentially the bone marrow transplantation also could change the cerebral and the central nervous systems impact done by the vascular disease related to sickle cell disease. So this is very encouraging for us and for all the ones that work with sickle cell disease. Bone marrow transplantation is a well-established treatment and is the only one treatment available that can cure the disease, the sickle cell disease. However, need to be improved in some aspects, mainly to graft versus host disease. But that's why many and others investigators are related to this field and implementing new protocols and try to improve the field. And Ribeirão Preto Medical School, our bone marrow transplantation unit, is part of this community, and we hope in the next years you have new data to publish. Unfortunately, during the last 2 years, you had a great impact in terms of transplantations because of the pandemic crisis of the COVID-19. But now we are coming back to with the bone marrow transplantation program for sickle cell disease, and all the research development you continue that you need to do.